Welcome back, everyone. This is Nisi Everett. I'm the host of Fibro Patient Education and Support, as well as the founder and organizer. And welcome back to Black Menace, our digital series, Survival Steps to Beat COVID-19 for African Americans. I have another awesome, great guest today. Her name is Shantay Carter, and I want to share with you some information about Shantay. When it comes to Shantay Carter, helping others for her is more than just a job. It's her passion and her purpose. From her daily work as a dedicated nurse to her ambitions as the founder of a thriving nonprofit organization, the New York native has an extensive history of letting her caring nature guide her path. Shantay attended Binghamton University, where she received a Bachelor's of Science degree in nursing. In 2000, she began working at Binghamton General Hospital as a registered nurse. And then in 2002, Shantay continued her career at Northwell Health Systems, where she currently works as an orthopedic trauma nurse. And after noticing the lack of guidance for young girls in the Long Island area, Shantay decided to create Women of Integrity Incorporated. The 9-year organization has already made huge strides in its mission to empower and educate women of all ages and ethnicities. She's also the best-selling author of Destined for Greatness, and she is a proud member of Alpha Kappa Alpha Sorority Incorporated, the NAACP, and the Nassau County Medical Reserve Corps. So welcome, Shantay. Welcome to Black Menace Survival Steps to Beat COVID.
Thank you for having me. Thank you.
You're welcome. So how are you doing today?
I'm feeling good. I'm doing good today. How are you?
Doing well. Thanks for asking. I'm so glad you're here because you have a very unique perspective on COVID-19 because you yourself had contacted the virus. And I would like to hear from you as to what was that experience like for you?
So I contracted the virus about mid-March, kind of like right as it was blowing up in New York. And I was actually working and caring for a patient who exhibited signs of COVID, but because they weren't necessarily diagnosing yet, they felt that he did not meet the criteria, but he had like the cough, he had the sore throat, he had a mild fever. And so I had been caring for him all weekend. And by like the Sunday, I worked overnights. So I went in Saturday night. By Sunday morning, I started feeling like my throat started feeling a little scratchy. I just kind of knocked it off that maybe I was just tired. And then by Monday, the same thing. So I was like, something, maybe I'm coming down with a cold, maybe I'm just tired from working the weekend. But then by Monday morning when I got off, going into Monday night, my symptoms progressed. So the sore throat became worse. I started having body aches, severe body aches, really intense in my right side of my lung, the lower part, like over by your ribs, and then radiating into my back. And then I just felt like extremely dehydrated. Just to let you know, I have no health issues, no comorbidities, no blood pressure, no diabetes, anything. So I'm fairly healthy. And I'm 41 years old. So, I was like, all right, something's up because I've really never felt like this. I've never had the flu. So at first I thought maybe it's the flu. So let me see how it goes. But by Monday night, going into Tuesday morning, which was St. Patrick's Day, I was like, I felt like I was literally dying. I was like, something is wrong. Can't pinpoint it, but I was like, let me go to the urgent care and get seen, because if I wait any longer, I was like, this, can progress, because it progressed so quickly. I was like, I don't want to run into trouble. So I went to urgent care. They tested me for the flu. I was negative. And then I was like, I'm a healthcare worker. I was exposed to a patient who exhibited signs of COVID, and I would really like to get tested for COVID. And so they said, okay, they finally agreed. And one of the biggest things while I was there is that thankfully I know my body. And so I know what's normal for me and what's not. So, for example, my vitals were there. I had no fever, but my blood pressure was like 130s over 80s. My heart rate was in the 80s. My oxygen level was fine. I was sitting, like 98 on room air. And then I said she's like, oh, your vitals are normal. And I said, they look normal for the average person. I said, but for me, they're not normal because I normally run 110/60. My heart rate is in the low 60s, high 50s normally, baseline. I go, so if my blood pressure is in the 130s/80s and my heart rate's in the 80s and I'm honestly just sitting here talking to you, my body's in distress. So please don't let the vitals fool you because they appear normal. They're not normal for me. So knowing that much, I was able to really advocate for myself to be like, I want more testing done. Let's, test me for COVID and let's see what's going on. So I finally got tested. I got my results like 3 days later, March 20th. But in between the Tuesday to the day I got my results, my symptoms got worse. At the time, I did not know you could not take ibuprofen. So I took ibuprofen like the Wednesday because the pain on my right side and my back was just so severe. And I'm like, okay, normally ibuprofen works for me with any kind of body aches. So let me try it. I took it, and literally probably within 15, 20 minutes, my symptoms became exacerbated. They became worse. I started having difficulty breathing. I was laying down, and I felt like as if I could literally feel fluid rushing up into my lungs, like start making me have difficulty breathing, almost like what a congestive heart failure patient might feel. And I was like, this is weird. Why do I feel like this? And then I just started becoming more short of breath. So I had to start getting up. I had to kind of like change my position. At that point, I started kind of panicking. And I was like, okay, Shantay, like what's going on? But then I was home alone. So I had to really get myself together to kind of calm myself down so that I could focus on what I needed to do because I was by myself. So I was like, if I really go into a full panic mode, it's already making my breathing get worse. Everything was constricting due to the anxiety, and I was having more of a hard time breathing. So I was like, Shantay, you have to calm down so you can focus to kind of assess, see what I need to do. Do I need to call an ambulance, or is it something that I could try to ride out? So I got up, I changed my position, walked around, and once I was up and moving, the symptoms started to alleviate. The shortness of breath started to get better. So, I kind of found that weird. I was like, wow, I thought the ibuprofen would help me, but it only seemed like it made me worse. So then literally the next day I saw on the news that you have to avoid taking ibuprofen. And I'm like, wow, I wish I would have known that yesterday, right? Because that's not something they told me in urgent care either. Like, don't take any ibuprofen or leave or, any of those kinds of medication. So then as the days went on, the shortness of breath, I started, depending on exertion, if I was doing something, I may have more shortness of breath. And then, you get the whole process of being contacted by Department of Health, them coming to visit you, to make sure you're in your home once you test positive, to make sure you're not out and about and you're following the quarantine guidelines. And my symptoms started to ease up a little bit. By the beginning of April, I thought I was starting to feel a little bit better. I still had the sore throat and cough and a little chest congestion, but I was like, all right, maybe I just need more time. They extended my quarantine. But then by like April 12th, 13th, 14th, around there, my throat just became like really inflamed. It was red, it was swollen. I couldn't even like swallow. I felt like as if my throat was closing up. It woke me up in the middle of the night. And then again, I was having like another anxiety attack. And I was like, something's wrong because these symptoms are lingering a little too long. So I decided to go back to urgent care again. Because at that point I started running fevers again. And I said, listen, this is my second time coming back here. It's almost over a month since I was here before, a little shy of a month, and my symptoms are still here. Something's going on. So, I really had to press on them, like, let's work me up again. Let's do a chest x-ray. Let's see what's going on. They did throat cultures, checked me for strep. I was negative. I said, because something's going on. So at this point, they were like, you got to follow up with your primary. I have been in contact with my primary after I got the diagnosis to let him know. And then he said, you know what, Shantay, I said, maybe I need some antibiotics or something. I was like, I know they're using that in the hospital. Maybe we could, he was like, it's still so new. And he was like, I don't want to introduce anything new into your body, not knowing how it's going to react to you. So honestly, I kind of had to write it out. So at that point, I was like, well, you know what? I'm going to start trying some home remedies. My family is Caribbean. They're from Jamaica. So they, they were like, let's start doing the home remedies. So I started doing boiling fever grass, or and here they call it lemongrass, boiling
Okay.
that, the lemongrass, putting it in boiling water, adding lemon peel, adding turmeric and ginger, and boiling that to a tea, and starting to drink that twice a day, right, to help with the congestion.
Mhm.
Also started doing steam treatments of putting orange peel in hot boiling water, putting a clove of garlic and some sea salt, and you can even throw lime or lemons in there, and then putting my face over it for about 15 minutes. Doing that really helped to open up my nasal passages, and it helped with my breathing, the tightness. And then also at that point, I said to them, I think I need an inhaler. I said, because I'm not an asthmatic, but I feel like the residual or the after effects of this will make me an asthmatic. And I was like, I really am. I said, if you're not going to give me antibiotics, please give me an inhaler so I can use it if needed. So they did. The inhaler definitely helped a lot with my chest tightness. It opened me up, which I was grateful for, because that pressure was just very uncomfortable. And doing the steam treatments and really start drinking the tea. I was also taking from the herbal store, it's a liquid called an immunity builder. So I started drinking that, taking that once a day, 10 mLs. And then the teas, I've still been drinking the teas, putting the turmeric or doing hot lemon water, because as we know, the virus can't, heat can kill it. So if you're drinking hot fluids, it'll help you. So every day I make sure that if I'm not drinking the fever grass tea with everything else in it, I'm doing hot lemon water. So boiling the water, putting a slice of lemon in it, like a tip of honey, and I'm drinking that. So I'm drinking in the morning and in the night to kind of help me. And then also my throat was hoarse literally over a month. Like, it's starting to sound better now. And I was doing the warm saltwater soaks as well. And just really trying to be diligent. But at that point of going to urgent care the second time, I was like, I want to get retested for COVID, because I still have these symptoms. And I don't feel comfortable in going back to work knowing that I could still potentially be carrying the virus, because I don't want to, potentially infect my family, which thank God they were never infected. Because really for me, doing the strict isolation, I said, and when I go back, my coworkers, they have families as well. So I don't want to potentially bring harm to them. So I finally got a second test. And I will say I had to advocate for that, because they were not trying to retest me. But according with the CDC and the guidelines, is that if your symptoms are still persisting, you can request a second test, because now you think I've been having symptoms over a month. So requested a second test, came back positive again. So came back positive a second time. And then I was just, let my primary know, and it's like, wow, you just can't shake it. He was like, I really think it's just going to take you a little bit longer. And he was like, so they continue my quarantine again for another 2 weeks. And he was like, I really want you to bump up, your vitamin C, and really stick with the home remedies that you're doing, because I don't want to introduce anything else. So I was like, okay, no problem. So I upped my vitamin C. I've been taking 2,000 milligrams of vitamin C a day. I have vitamin D, which I upped from 10,000 units to 20, taking zinc, and really just started now focusing on changing my eating, my lifestyle, as far as trying to really focus on getting healthy, to really build up my immune and really focusing on that. So then I said, okay, my 2 weeks is almost up. My primary is like, well, before you go back to work, I would really love for you to get retested a third time. He goes, they may or may not want to test you. He said, but I want you to get tested, because I want to see if it's still in your system, because he was like, I don't feel that you got reinfected. I think it's just still from the initial contract you contracted. It's just been in your system all this time. So I end up going for a third test, May 4th, and then May 5th. And then it came back negative, thank God.
Yes.
So God is good.
Yes.
So it came back negative, and it was like a sense of relief and a weight lifted off of me. It was like the best news I've ever heard in my lifetime. I don't even know how to explain the joy that I felt and like what my family felt, because from March up until then, it's been a rough road for me, a long road of recovery. Especially in the beginning, I was just so sick with the symptoms, and I had every symptom. You know, I had headaches. I had the loss of sense of taste and smell. I had the chest pressure and tightness. I had the right lower lobe pain. I had back pain, you know, body aches, fevers, the runny nose, severe congestion. I had headaches, diarrhea. I had every single symptom that they can think of that they say is a part of COVID. I had it. So to go from that to where I am now, I would just tell you, you know, like I said, God is good, you know, because I'm really grateful. You know, I never really thought about like being lucky or honestly even being blessed. I was just so happy to get through it until my doctor said, you know, Shantay, you're one of the lucky ones. And I was like, when he said it, I would tell you honestly, it brought tears to my eyes. Oh, I'm so sorry. It brought tears to my eyes because I was like, I've never thought about it like that. And then when you look at the bigger picture, so many people have lost their lives to COVID.
Yeah.
So many healthcare workers, my colleagues, have lost their lives, whether I knew them personally or not. They're still colleagues. They lost their lives due to this virus. And, you know, to be able to be here to share my story, then yes, I am considered a lucky one. I'm blessed. And I'm so grateful and thankful. You know, I feel like God still has some work for me to do, my purpose. You know, I tell people all the time, you know, so I was never at work because right when I went out, my floor became a COVID unit. So I was never actually caring for COVID positive patients. But reflecting and looking back, I said, I think that was God's plan. I don't think I was supposed to be there, right?
Right.
Things changed in healthcare instantly at that point. You know, hospital policies change. A lot of things that we were never doing, we were doing. Things that maybe I might not have considered to be ethical or right were going on. And knowing who I am and knowing that I'm always going to be a voice for the voiceless, probably would have said something. Well, not even probably. I know I would have said something. And then that in turn might have cost me my job. So I look back at that and I think this was all God's plan. I don't think I was supposed to be there. Because like I said, I really think if I was, I might not have a job today because just of who I am, the person that I am, and know that I would speak out against anything that I felt was unjust. And I feel that as a healthcare worker, despite the fact that we're in a pandemic or whatever's going on, you have to always have integrity in your profession, integrity as nurses. If this is why we are the #1 most trusted profession. But if you throw out integrity and ethics out the window, then this is where the problem starts, right? Because now you're bringing in chaos into our profession. You're bringing in chaos into the healthcare field. You're bringing chaos into the hospital and with this care with these patients. So yes, I understand that it was a crazy time. This was a new virus and people were just figuring it out as they went on. But certain things you don't throw out the window. You know what I mean? So despite the fact that, you know, some of the government regulatory agencies dumbed down on their guidelines for us, to me, that was unacceptable. I understand that there was some shortages and we were in a pandemic, but that's still unacceptable. You know, some people lost their jobs because they wanted to wear their own PPE and bring their own N95s to their workplace. And they got fired for that. But then you have the CDC 2 weeks later go, oh no, now you can wear your, and then it's like, but how do you reverse the people that lost their jobs behind trying to protect themselves? Right.
And everybody wants to be safe because the goal is at the end of the day to be able to return home to your loved ones,
of course,
to friends, to stay safe. Now, when you first started feeling poorly and you knew something was off, so that patient that you mentioned, at that point in time, were you all wearing masks or?
So at that point in time, we were just wearing surgical masks.
Okay.
We're not wearing N95s.
Just wearing surgical masks. All right. And so it sounds like, number one, I'm happy that the first thing you said that was vital was, you know, your body.
Mm-hmm.
That's vital because we have to know our body to know, is this normal for us or is this abnormal for us?
Correct.
Other two that I picked up on, it doesn't sound like it was easy for you to get initially tested.
Right, because at that time it was still new. You had to meet like a certain criteria. So if you think about it, what they would consider the criteria, I needed to have a fever, I needed to have a cough, or the shortness of breath. I didn't have a fever when I went there. My cough was infrequent, kind of sporadic,
Mhm.
and then I wasn't presenting with shortness of breath at that time. Just because I knew my body, I think is what helped me. But also at the time, I think because I was like, I'm a nurse and I need to know before I go back to work. So that's what really prompted them to say, okay, But getting retested was a fight because they didn't believe that you needed to be retested. And I said, for me personally, I have to make sure that I'm going to be 100%, right? Because
Right.
these patients are very sick. So when I go back to work, I have to be able to provide them with 100% and give 100% to these patients because they're going to be counting on me and looking on me for comfort, to help them with their anxiety, ease whatever fears that they have, and to properly treat them. But if I'm not 100%, how can I do that?
That's true. And then the other thing too is I would think for someone who's working on the front line, like you as a healthcare provider and nurse, I would think, to me, it's a no-brainer that it shouldn't have been a problem to be retested, the second time when you requested it. Because if I have a family member in a hospital and the nurse has already had exposure to it, you want that nurse to have been retested to know where they stand.
Mm-hmm.
And I just don't understand that mindset to think it's not okay, because to me, that's, what's the right word for that? That's taking shortcuts. And like you said, you're going to give your very best to your patients. Just like you don't want to take COVID home, you don't want to bring COVID to anybody in the hospital.
Correct.
Especially if they already have comorbidities, weakened immune system. So you're just wanting to do your job ethically and morally.
Right.
Wow.
And then, because you have to think about like people, because during this, I've heard people say, well, this is what you signed up for as nurses or, whatever. As a nurse, you signed up to save lives, right? Care
Right.
for people and take care of them. We did not sign up to risk our lives. There's nowhere in our oath that says we're going to put our life on the line. There's nothing that says that. So when I hear people say comments like that, it's like, what are you even talking about, right? Because
Right.
at the end of the day, my health comes first, right? Because if I die today, they'll just replace me. That's just how it is, right? That's just a
That's
fact.
what you do. That's what you
Right?
do. Yeah.
That's with any job, not
Yeah.
even just nursing, any job in
Yeah.
general.
Yeah.
You
Yes.
die, they're gonna find a replacement for you, right?
You get
May
sick.
not be right away,
Yes.
but they'll find a replacement.
Yes.
So I can get another job, but I can't get another life.
No.
Right? So for me, I have to be the advocate for me, right? Because no one's gonna look out for me but me. So I have to look out for myself and be able to advocate for myself. And I want to make sure that my health is in tip-top shape before I return to a workplace that, like I said, I would be caring for COVID positive patients. If I'm not 100%, then I'm going to be more susceptible to possibly getting reinfected or, like I said, infecting other people, which is not something that I would want on my conscience. It's not something that I would want to do. Like I said, I put my health first when it came to returning to work and what I would do and what I won't do. And me getting the third test was also for me for reassurance so that when I went back to work, people would feel comfortable being around me. My family could feel comfortable. I wouldn't have to worry about infecting my family. I wouldn't have to worry about infecting my coworkers because at this point, now I'm negative, right? So
Right.
now, and I looked at it as, so I'm negative, I can go back to work with a clean bill of health. If I end up positive again, that would mean I got reinfected. Not that it was still in my system, because now we know I'm negative. So
Yes.
that was also the purpose too, because I've been fighting this for a long time, and I feel like, some people have it hard to get testing, and I feel like even that in itself is an issue. You cannot necessarily, they're changing some of the guidelines, but a fever is not the staple guideline anymore, because not everyone is going to present with a fever. Like my fevers never got to the 102s, 103s, but I
Yes.
still was positive for COVID, right? Everybody's body is different. So definitely I would say, I made sure I actually ordered a pulse oximeter from Amazon, right? So what we
Right.
call pulse ox, that's going to monitor your oxygen level and monitor your heart rate. It's probably under $25 on Amazon. It may be a little delayed in coming just because of COVID, but I would highly encourage you to order it, right? Order one. Get a blood pressure cuff if you don't have it. As people, we need to start, and in the community, we need to start taking charge of our health and the Black and brown communities. We really need to start taking charge of our health. And if you feel like something is wrong, you know your body better than anyone else. Don't let them tell you, oh, no, you're okay, because what you know your body, you know what you're going through, right? Everyone has the right to be seen. Everyone has the right to be treated. You cannot be turned away.
I hear you, and I agree, and I also feel too that sometimes you've heard this saying, you don't get it till you got it.
Right.
Okay. You presented as someone that didn't have any comorbidities, perfect health, but yet
Right.
you got, okay. So for those people who say, oh, if you're healthy, you can't get it. That is not true.
No.
And we, the Black and brown community, must be, and you and I have talked about this, we must be our own healthcare advocate and oftentimes our own healthcare detective.
Yes.
And we've got to speak up, so challenge them. To me, challenge the status quo, challenge people, in healthcare, that when they say, oh, that's not necessary. Really? Why is it not necessary? Why is it I test it? Why is it I can't get a third test? For your own reassurance. And there should be nothing wrong with that, because after all, if they say that there's tests readily available, available, if that's the case, then it shouldn't be a problem, right?
Right. Exactly. And I will tell you, the issue behind the retesting is more of, at the time they said they didn't have enough tests. So it was about they allegedly not having enough tests to test me, right?
Right.
And then I posed the question, well, so you would rather not retest me, but potentially allow me to come in and infect a whole entire hospital, a whole entire unit, or the community, or my family, right? I go, to me, that doesn't make sense at all, because I'm one person out, but now when you talk about 50 to 70 people out of work, that's a whole nother ball game. And that's a whole lot of money you're going to be spending, right? For leave of absence, workers' comp, whatever it may be, as opposed to you just could have been doing one person.
Yes, I know. And more needs to be done, because in all communities, especially Black and brown, as well as Native American community, everyone does not have access to the test. And if there is a testing site, you can show up, but it doesn't mean you're going to be one of the ones that they're going to attest to. And that's something that people are not talking about. But we as people of color, we understand that, because we know about healthcare disparities. Going back to, I remember the Tuskegee experiments with the syphilis. We've seen it time and time and time again what they do. And some people may call me a conspiracy theorist, but I think some of this is also designed to really get rid of Black and browns. So if if they can just, I think sometimes the answer is just die off. We don't want you to begin with. And if you're weak, and you're sick, they don't want to invest in us to begin with, because they're making value decisions about who deserves to live and who needs to expire. I mean, that's what I over the years, and that has not changed, and I don't think it's going to change till Jesus comes. That's just my own personal opinion on it. Now, you also mentioned that a visit by the Department of Public Health.
Yes.
Okay, so when they come visit, what are they looking for? Are they checking just to see if you're at home?
Yes, I had spoken to them. They called me to let me know that I tested positive. This was when I got first tested in March. And then the next day, they literally just showed up. I didn't even know they were coming. So they called, but I didn't recognize the number, so I didn't answer. And then they texted me, like, we have one of our agents outside. We just want to verify that you're home. So please come to your door and wave. And then I was like, oh, at first it's kind of like, that's a little creepy, kind of Men in Blackish, little government pull up, like, what's going on? Like, all black SUV tinted out. I was like, oh, this is a little, okay. But I went to the door and like waved to them and they said, okay. And then they drove off. And I was thinking like, wow, what if I wasn't home, right? Like just say, like what would have happened, right? And, I was talking to my aunt and she's a nurse as well. And she was like, Shantay, you would have gotten in big trouble. They would have probably had the police looking for you because this virus is so contagious,
Yeah.
that they would have been like, if you're supposed to be in quarantine, why are you not in your home? She's like, I guarantee you they would have had the police looking for you. And I'm like, that's so crazy, right? But I get it, right?
Yes.
Because I do understand why they did that. But, in the moment, it was kind of like, oh my God, this is so weird. But definitely, they didn't come in. They just stayed outside, but they just wanted to visibly see that I was in my home, right? But
right.
my aunt said, but Shantay, they already like ran your license, ran your ID,
Yeah.
kind of what you would look like, right? When you come to the door, because they don't know what you're, right?
Yep.
I said, you're absolutely right. She goes, they probably access DMV to get
Yep.
a picture of your license, to have a picture of your face so that they would know that it would be you when you came to the door. And I go, you know what? You're absolutely right. So yeah, definitely. So they will, some people said they just called. But for me, I think because I also live in close proximity to the Department of Health, it's only like the next town over from me. I think it was easier for them also to just literally pop up. You know what I mean?
Now you could have been asleep. So let's say they call, you're in your bed sleep, you're taking a nap, you're feeling well. And I'm really wondering if they're doing that across the country, because I've heard other people who say they have COVID and nobody's called them. And I don't know if it's because demands, upon their resources, them not having enough people. I get that. It's interesting that, they call you. I understand why they do it. But likewise, what I would also like to see them start doing is when you go out. So, for example, grocery stores, there's something got a sign on the door, Shantay, that says, no entrance if you don't have on a mask. Okay.
Mm-hmm.
Now, you have some people who enter these places anyway with no mask, and nobody's putting them out of the stores.
Right.
So they're coughing and there's spittle and stuff everywhere that you're stepping into, and you're taking that back home with you. So just like you who had COVID and they're checking on you, I would like to see them show up to some of these stores to say, hey, are you doing what you're supposed to be doing? That's just my thoughts on that for what it's worth. Now, when you mentioned about the antibiotics, I wonder, did they not initially prescribe because the fear of antibiotic resistance? Because remember,
it could have been. And at that time, like I said, when I was probably literally one of the first nurses in my hospital to be diagnosed.
Okay.
If not the first, right? And so to go there as a healthcare worker, I think also at the time, it was literally just exploding. So
yes.
Treatments and ideas of what the treatments should look like, I think was still new. They did not necessarily know, right? So when I went initially, they gave me a cough medicine and that was it. I got a cough medicine that helped me with the cough, right? So looking back, I think that cough medicine really suppressed my cough, because it wasn't until after I ran out of that medication that my cough started to become more frequent, right? And then I started bringing up more mucus. And so I don't know, my symptoms, just like I said, it lingered. And then when I went back the second time is when they put me on the inhaler, and then they put me on a stronger cough medicine.
Okay.
To kind of help with that. But even the second time when I was like, maybe some antibiotics, and they were like, we don't want to start treating you if there's no reasons to give you antibiotics, and start putting you, and then you could become resistant. Sure. And I was like, you know what, I get it. And that's the same thing my primary said. He was like, like I said, Shantay, I really don't want to just be putting you on antibiotics to put you on antibiotics, So I just had to really honestly tough it out, really tough it out.
I can understand that piece about the antibiotics, especially because we've had in this country beyond issues with antibiotic resistance treatment, resistance therapy. So I can see them not wanting to, put something else in the body. Now, you shared with us about your family recipe, your holistic treatments. So you mentioned there was lemongrass, lemon peel, turmeric, and ginger. And orange peel. Mm-hmm. And orange peel. Okay, an orange peel. So if I may ask you, I'm not asking you to give away how you all do everything with your family recipe, But I did buy some orange peel 2 weeks ago. I've been using, not orange peel, lemongrass. I've been
Okay.
using grass in my meals, as well as ginger,
Uh-huh.
because I know all that is healthy for our bodies, for,
Mm-hmm.
has healing properties.
Anti-inflammatory. Yeah.
Turmeric I don't use too much of, because I'm allergic to it. But
Oh,
I
okay.
that you implemented this holistic treatment and how it benefited you. And then you mentioned something about an immunity builder, and
Right.
you also 2,000 milligrams of vitamin C, and the vitamin D you went from 10,000 to 20,000, and you
Right.
also apply zinc. So once you started that protocol, how did you start feeling? How long was it before you noticed any signs of improvement?
So I always took vitamin C, but maybe like just 1,000 milligrams. I always took it just to help me with my immune system, and it's good for healing. I later, after speaking, so this new homeopathic natural is kind of more of a new way of life for me, because I wasn't necessarily into that. And I reached out to my colleagues that's more of their thing, and started asking them what do they recommend. And my girlfriend, who really eats clean, nothing dirty at all, was just like, you need to get your vitamin D, up your vitamin C, whatever you're taking, up it. And she said, get some vitamin D and get some zinc. Emergency, the packets have been like sold out, so I haven't been able to get any of that, which has a good source of zinc in it as well. So if you can get emergency,
Okay.
definitely I would say get it. But I haven't been able to find it here. It's been sold out. So, and I told her, I said, I'm taking the 10,000 units. And so she was like, she's from Haiti. So she was like, I talked to my mom. My mom was like, tell you to up it. Take double the dose, like double everything for like a week or two, and see how you're feeling. So I was like, okay. So I did that, and I started to feel like it was helping me, but I just continued it, honestly. Right now, I've just continued taking the 2,000 milligrams, taking the 20 units of vitamin D. And my zinc is in a multi-supplement, so it has magnesium, calcium, and zinc. So I'm taking that, but I'm taking 2 pills, even though it was said like 1 pill. I'm taking 2 pills. So really just kind of still staying with that up regimen just for right now, because it's a lot. Your body goes through a lot in the recovery
Yeah.
process. And like I said, everyone recovers different. Everyone's symptoms are different. Some people have mild symptoms. Some people have severe symptoms. Even though you may not necessarily go to the hospital, you still can have struggle and have severe symptoms.
True.
Personally think if I didn't go to urgent care and I would have waited to like maybe the Thursday, the Friday, I probably would have had to be in the hospital.
Yeah.
It just would have gotten so severe.
And you're right. There's different degrees of this, because some people are carriers and don't even know that they have it.
Correct. They're asymptomatic. Correct.
Yeah. Now, what are some takeaways that you can share with us, since you're now on the other side of the mountain?
Like I said before, definitely knowing your body. I really urge everyone to know their body, to know your numbers. If you don't have a blood pressure cuff, get one. You can get them at CVS, Walgreens, order it online at Amazon, Walmart. Also invest in a pulse oximeter to measure your oxygen level and your heart rate, because that you can tell, especially the pulse oximeter, it can show you if your oxygen levels are dropping, right? So
Right.
normally you want to be between 96 and 100. But if you check it on your finger and it starts saying your oxygen level is going down into the 80s or 70s, you may not necessarily be short of breath at that point. But that would let you know that something's going on and I need to go get checked out, right?
Okay.
You know what I mean? Or, because they've been also finding that it's a lot of clot formation with COVID, right? So if you have a history of blood clots, you want to be concerned. You want to make sure you're taking your anticoagulant, whether it's Coumadin, Xarelto, whatever. You want to make sure you're staying on top of those meds, because that's been prone in these patients as well, right? So if you're home positive for COVID, I don't want you just laying up, because laying up is going to make your blood thick and still and can make you more prone to clots. You need to still be moving around. Even if you're not feeling well at your worst, try to still get up out of bed, and even if you sit in the chair for 10 or 15 minutes and then you go back into bed, but you need to be moving. You cannot just lay up with this. right? Because then it's like the mind over matter, and then your body feeds into that, right? Oh, I'm sick. I just, and then you're in quarantine, so you can become depressed. I would tell you, it was very frustrating for me. I can count the number of times that I had anxiety, panic attacks, probably about 4 during the whole thing, because the first one was initially when I got diagnosed, because I'm like, oh my God, I have this. And then my family and friends' reaction was they started panicking. And some of them were crying. And then I found me getting more emotional. And then I realized the more emotional that I got, the worse it made me feel. Everything started tightening up. So I had to tell my family and friends, please, if you're going to call me and check on me, I need you to not be crying, because it makes me start to get emotional, and then it makes my situation worse. So you kind of have to be intentional with the energy that you let in and around you, because you have to really try to stay focused on having a positive mindset and pushing that you're going to get through this. Because if you tell yourself that you're not going to get through it, then you're not going to get through it. Right?
Yes.
Whatever you feed yourself is what you're going to believe. So if you say, oh, I'm going to die, I'm not going to make it, then your body's going to go, okay. So you have to really be mindful of the words that you speak over yourself, and what your thought process is. Yes, I'm not going to tell you that you're going to be hunky-dory happy the whole entire time, because I wasn't, and I was very frustrated, right? But I had to just try to keep pushing and staying positive, because I said I have to get through this, right? Because I felt like there's still things that I want to do. There's still things I need to get through this, right? Because I have a bigger purpose. So I need to get through this. And if you have a supportive family system or friend system, that helps. People checking on you, or just what you're learning, you share, right? Like I said, I'm able to share information, because if it helps one person, then it's done. I'm doing good. It did good, right? Instead of me holding my experience. I find that some of us are scared to share that you may have been positive because of what people might think. But you never know who you could be helping in sharing your story, because that person could have similar symptoms or have the same exact symptoms you had, but didn't think they had COVID. But now they go, wait, maybe I do. Let me go get tested. And you could be saving a life, right? So sharing, to me, is fine. We're supposed to share. It's each one teach one. So I don't have a problem sharing like the home remedies to tell you exactly, because that's going to help you or help the next person. That's what we're supposed to do, right?
Yeah.
We're supposed to pay it forward.
Because sharing is caring, and telling your story, I find it very powerful. Thank you for doing that. It's going to help save so many lives. And then the other thing too, the reason why it's vital to share these stories is because sometimes in Black and Brown community, many of our people don't trust going to the doctor.
Right.
That's fear. But hearing your story, your journey, that's something for people to really listen to and say, you know what? Now is not the time for me to be afraid to go.
Right.
I'm experiencing this. I need to get it checked out for myself, for my family, for my children, for whomever.
And we don't have to always, and don't necessarily just take the first no as the answer. If they say, well, no, we don't think you have it and you're fine, but if in your heart and soul, your body does not feel fine, then you need to push that envelope. You need to ask questions. You need to really, because you have to look at it. This is my life. It's either I'm going to live or I'm going to die. It's a life and death situation. And that's how I kind of looked at it. It's like, do I want to live or do I want to die?
Right. You're fighting for that. Yeah. You're fighting to be heard. Number one, that's you're fighting, and you're saying, hey, look at me. I'm here. I'm talking to you. I'm a person. My life is valuable just like yours and everyone else's. So listen to me. I need help. I need support. That's not the time to be saying, okay, I'm just go home. No. Right. And if they won't listen, find somebody else who will. So
and that's true.
Yes, I want to come back for a minute to the lemongrass, the orange peel, the turmeric, and the ginger. So how did you use all that? So were you like buying these ingredients and chopping them, boiling
actually, them? And this is what I say about a wonderful support system. One of my colleagues, she's a nurse practitioner. She saw that I was going through it. She was like, I'm doing this. She said, I've just been doing this to help my immune system, my mom and I. She's like, I'm going to bring you some of this. Try it, boil it, make it into a tea. So I boil it and make it into a tea. So she brought it to me, the lemongrass and the immunity builder. The immunity builder comes in a bottle, and I would take a teaspoon, 10 mLs a day. The fever grass came in like a little container. And then I just took a little bit of it, put it in a pot of boiling water, added the orange peel, added ginger. The turmeric, yes, is an acquired taste, and if you're allergic, it's, then I would say you're gonna have to stay away from that. But
Right.
but I added that and then let it boil. I let it boil, come to a boil, and then after that, I turn off the stove and I put a cover over it and kind of let it simmer. And then I come back to it later. So kind of, in essence, like it ferments so that it can get all the nutrients. And then I drink it. So I don't drink it right away. I let it cool down, sit, kind of ferment, and then I may just pour some, strain it, because you don't want the fever grass in your cup.
Right.
Strain it, and then I'll, warm it up, and then I'll drink it.
Okay.
If you don't have that, but if you have lemons, just slice your lemon, put it in a cup of hot boiling water, and drink it.
Now, when we were children, my sisters and I and my brother, if we got sick, we felt we were coming down with a cold or something like that. What would happen would be they would have us do lemons with honey and different that. Yes.
You
Okay.
definitely could do that. Definitely.
Yes. Okay. And then the other thing too is we're out of time. So can you tell my audience where they can find you? Because I know you have a not-for-profit. Where can they go to learn more?
Yes. So let me just say this quickly. I went back to work, everyone, so that you know. I went back to work on Monday. Monday night was my first night. And I want to just, as I said about amazing support system, I want to thank my coworkers because they made my transition very smooth coming back. And they really helped me to adjust to this new way of life and to the hospital. So I definitely want to thank them for making my first night back a smooth transition. But I will say yes. So I'm the founder of Women of Integrity, Inc. You can follow my nonprofit at www.womenofintegrityinc.org. And that's all geared toward women's empowerment and girls' empowerment. And we host different events through community outreach, like a prom dress drive, prom dress giveaway, prom makeover, women in business brunch. We work with the local high schools after school mentoring program. And then we usually host like a community barbecue where we give out awards to other organizations and our members. And to follow me personally, if you have any questions, you can follow me at my website, www.scarterrn.com.
Thank you for being with me here today, Shantay. And I
Thank you
welcome
for having me.
come back another time because your story is very powerful. You're a beautiful person, beautiful woman. And I'm glad that you're feeling better and that you're positive. And so God bless you. And thank you
Same
for.
to you.
Okay.
Stay safe and be well.